Hello friends, welcome back to the healthcare today. Today we are going to discuss most common element. After viral infections, most of us feel that there is a sore throat or most of us feel there is difficulty in breathing. Why is that happening? So as we explained in the previous video, viral disease creates significant inflammation inside the body. The upper airway muscles, they are under constant inflammation even after you recover from viral infection, because the viral particles, they release these inflammatory markers, they stay in the body for longer duration. With those inflammatory markers, the upper airway, which is supposed to be very lubricant and very easy to pass, it has some amount of inflammation, thereby leading to the narrowing of the lumen. Once this happens, you feel that something is stuck here. Most of these patients, after having recovered from the viral infection, they still feel that there is something stuck in their throat. So because of the inflammatory activity. So how do we treat these patients? Once we found out that these patients are having symptoms, instead of recovering from viral infection, we start them on anti-inflammatory agents. And at times we use antioxidants to suppress the inflammatory activity which is happening. So many times after giving these anti-inflammatory agents and antioxidants also, patients do feel that they are having shortness of breath. These patients are subject to pulmonary function test, also called spirometry. We tend to observe whether your lung is having any problem due to previous viral infections. Few percentage of patients after recovering from viral infections, they tend to have symptoms like bronchial asthma. Just like an asthma patient, they tend to have cough with whitish expectoration, some amount of chest tightness, which is very commonly seen in them. These patients, depending upon the spirometry values or PFT values, we ask them to take inhalers for shorter duration, maybe 4 to 6 weeks. After 4 to 6 weeks, most of these patients improve and we stop these inhalers. But what happens after giving anti-inflammatory agents, antioxidants, and even after giving inhalers? Some patients do find that this problem is persistent, that this sore throat and other symptoms are persistent. Why is this not improving? These set of patients are referred for sleep studies, because once you ask their history, they do tend to snore and they tend to have breathing difficulties during their sleep also, which they themselves doesn't notice, but their partner do notice. Once you find these symptoms, they tend to have mouth breathing. They open their mouth and they take breath. Because of that, the upper airway lubrication is lost, the saliva gets dried up, and the saliva has multiple useful bacteria which acts as an anti-inflammatory agents. So these bacteria are not present, so thereby leading to significant inflammation. Thereby people have recurrent cough, sore throat, and some amount of difficulty in breathing. Once we find these symptoms, we ask for a sleep study. These days, the sleep studies are done at home. We see your sleep study values, whether if the apnea levels are very severe, moderate or mild. Depending upon the severity, we advise treatment for you. And also weight loss. Weight loss is an important step in having these mouth breathing sorted. So we also ask you to do regular physical activity and other important activities, thereby you lose weight and also have good breathing during sleeping. So once this happens, we do treat you for sleep apnea and all your problems do settle down. So it is very important that if your patient is having persistent sore throat or his BP is uncontrolled, do get a sleep study done, which will give you a permanent solution for all these problems. We care about you.